Hello, everyone. Thank you so much for joining today's webinar. It's entitled How COVID-19 Has Made the Clipboard Obsolete for Dentists. And I know that's a little tongue-in-cheek, but we're going to talk to a great person in the dental industry about that solution and about some solutions we've had. I am Keith Washington. I'm the VP of Products here at ProSites. And ProSites, as you know, is the leading provider of digital marketing solutions and patient engagement solutions to dental practices. And today I'm so excited to have Dr. Tom Cockerell with me to talk about moving your practice to dental solutions. Before I introduce him or before I say hello, Dr. Tom, let me just give you a little background. Dr. Tom Cockerell Jr. is a graduate of the dental school at the University of Texas Health Science Center in San Antonio. Since 1980, Dr. Cockerell has conducted a practice in Fort Worth, Texas, with a particular focus on patients with special needs. His practice name is Texas Special Care Dentistry. Tom and his wife Patty have been married for 43 years and have 3 children and 1 grandson, I think maybe 2 grandchildren. He plays the bass guitar in the TCC Jazz Band and a few scruffy rock bands as well. Dr. Tom Cockerell is also the owner of Dental Symphony, an online software solution used by many dentists and provided through us at ProSites to enable safe care of dental patients. His experience dealing with medically compromised and challenging patients has led to his conception and development of the products for Dental Symphony. Thank you so much for joining me, Dr. Tom.
Well, Keith, thank you. I want to point out that I have 3 grandchildren now.
I thought so, yeah.
3 boys, and I thank you for that kind introduction. I'm happy to be with you today. How are you doing?
I'm doing great, and we've known each other for a long time, so I'm really excited to talk to you about this
Yeah.
particular topic. So let's just get started in it. Tell me a little bit more about your background and journey into dentistry and, as I call it, practice optimization, something that a lot of practices are thinking about today.
Yeah, good. Dentistry has been part of my life, all of my life that I remember, because my dad was a dentist and he practiced nearly 60 years. And there was always something that I was interested in, thought was fascinating, would be fun. I enjoyed watching him and interact with patients. And so I was sort of headed that way for a long time, only to get to dental school to find out that I really knew nothing about dentistry. It gave me no heads up at all about what what I would actually be doing. But I'm thankful that I did that, and so that was my initial exposure to that.
And what about practice optimization? You talked a little, I talked a little bit about that, how when you created Dental Symphony, there was a reason for that.
Yes. Gosh, a number of years ago, when I, essentially over 1 week, moved my practice from a paper-based practice to using an electronic record, I was so surprised at how unhelpful the electronic record was. It just did not really help me very much in what I was trying to do to get people treated. If anything, it was harder and it took more time and it was very frustrating. And I began to think of ways to make adjunct kinds of of software that would be helpful to that. And the first example would be helping with the medical history, because of the nature of my practice, having so many patients with special needs. So that's how I started doing it, was to try to improve software.
So we, and we've worked on online forums together, and yours is called ePatient. And as when I first started working with you on this, we knew that lots of people had a fillable PDF or a PDF sitting on their, website that we provided for them. And we just went through this crazy year, still into it, but this crazy COVID year. And I really, first of all, hope that your practice has come back strong since the closures, which, if you think about it, at this time, it's a little bit more than a year ago. So how did COVID change your dental practice and those of your peers and colleagues?
Yeah, that's a good question. It certainly did impact me. It impacted everybody because we had to shut down the office. And, it's kind of interesting in my case, because I had, unfortunately, had a fall and had a hip problem, and I was in a rehab facility for a few days, and I had been reading about the COVID virus and following that story for several weeks. And then when I was in this hospital, in this facility, I noticed that it had reached the West Coast, and I realized I need to get out of here. This is going to make a beeline for these dense population of patients, and I just need to get out of here. So I did as quickly as I could because I just felt like it was coming. And then I think the same thing happened to all of us in the United States, I guess around the world. Two things happened. Um, Things moved very slowly and then very rapidly, almost at the same time, because all dentists knew that this was coming, and it was affecting the communities. And we all knew that at any moment in the future, um, an authority could say, close your doors, go home, you may not see patients. We kind of saw that coming, and that moved kind of slowly. And then when it happened, it was immediate. I mean, it was just immediate. The doors were shut. And so fortunately, we had time to give some advice and warning to our staff that, that it's possible that you're going to be furloughed. And I don't know for how long, but this is probably coming. So that's how it was for me, and I think for most everybody. And there's clear evidence of that data that we keep with Dental Symphony of the online activity in general of dental offices in a large customer base showed a dramatic drop. I mean, within days across the country of activity that had been happening on an ongoing basis, just literally went to near zero.
Hmm.
It's an amazing phenomenon. And then about 6 weeks later, it picked back up. Offices were opening up. And what's interesting is that the volume tripled. So it's clear that dentists began to embrace online activities such as forms to help manage their practice. And they did, and it came up in a very predictable slope, which showed the increase of activity. So in my case, and I'm sure like a lot of other dentists, we used that time that we were away to embrace technologies and figure out ways to decrease the exposure of patients to staff and to each other, and increase efficiencies and make it contactless. So the use of online forms to keep your reception rooms clear of patients and to help safely bring it into the office was really almost mandated. And so a lot of dentists have moved to that, and it's very efficient.
So you can see, it's really interesting. You can actually see the practices migrating quickly over to what we would consider to be online patient forms or more
Mhm,
digital solutions. And you've always
mhm,
been a proponent of using real online forms as part of the intake process. But now you're really pushing, and we've been talking about doing that before a patient comes in to the office. And one of the
mhm,
benefits is, not waiting. And, this whole webinar is talking about how we make the clipboard obsolete. And
mhm,
I still go to some places and some medical, actually, when I went to get my vaccine, somebody gave me a clipboard
mhm,
to fill
mhm,
out my
mhm.
information, which I thought was really strange. But why do you think that's even more important now?
Well, I think for a number of reasons that are related to besides to COVID, but COVID is the driving force now. And the system that ProSites makes available for dentists is um, capitalizes on just the online activity of saving time so that patients can fill out forms before they come to the office, so that the staff can have them well ahead of time to check on insurance and make sure it's appropriate, patient for your updated record. It just saves time. And um, the e-patient product that has online forms has the advantage of being a virtual kind of experience for the patient that's very helpful to the office. for instance, when the patient fills out the medical history, if they check diabetes, they're going to get a follow-up question immediately that gets the information that the clinicians need about diabetes. What's their A1C level? How often do they check their sugar? Does it impact your life? And the dentist can then begin to discern whether or not they may need to modify the care for this patient. So all this happens even before the patient arrives. And so aside from those clinical advantages, of course, is the advantage of the staff to be able to integrate that information directly into the patient record. And so that when the patient comes in, they can be seated just right away. And everything's worked out ahead of time. Patients like that too, because nobody likes to fill out a form on a clipboard.
Yep,
At least.
sticking to the patient side of that. One of the issues that I've always had is a terrible writing. My mom used to say I should have been a doctor because my writing was so
Mhm,
bad.
mhm,
Do you see benefits in being able to understand what I'm saying? There's two things that I always complain about when it comes to if I'm going to the doctor, the dentist, or any type of form. I can't fit in the boxes that they provided with me,
mhm,
even if it's a
mhm,
typed in PDF. And two, I don't know all of the answers to the questions.
mhm,
I can't remember what
mhm,
drug, what's the exact name of the particular drug if I'm taking a particular medication, or
mhm,
when was the last time I had surgery. All the questions that they ask that at the end of
mhm.
the day, I make it up. And so I want to ask that question first, and then I have a follow-up question about that.
Yeah. Well, I think first thing that a patient thinks about when they're filling out a paper form, yes, you can't get all the information in there. Sometimes staff can't read the information, but the question is, who's going to see this? I'm going to all this trouble to fill this out. I'm going to see 6 people before I ever see the doctor. Are all of them going to see this form
Hmm,
and this information?
hadn't thought
Then
about
they
that.
get directly to the doctor. So, in the digital way, it's made available on many platforms throughout the patient's journey. And so, I think there's some reassurance to the patient that this is not going to get accidentally put in somebody else's chart or trash or whatever. So, Keith, I don't know if I'm answering the question
No,
you
you are.
asked me,
You are.
but
You're answering the question about I don't know how to answer all of the questions, or I'm not sure.
mhm,
But one of the examples is I'm not sure if I type in the name of the medication correctly.
mhm.
Have
Yeah,
you solved that problem?
that absolutely, because we provide a list of drugs that the patient can choose from, and you can search them by category or by start typing the name of the medication in, and you get it, and you can choose it and select it. Not only are you sure that you've told the doctor what medication you're taking, but the doctor, in the information that they get from the use of e-patient, will provide for them a description of that drug and any concerns about interactions or actions of that drug that may be of importance. So yeah, it helps the patient in making sure they get correct information there, and it helps the clinical staff know immediately as they're looking at a report about the patient's medical history. Excuse me, the medical history, that they know what medications they're taking. So, and that's just one of the things that comes from virtual forms. There are a number of other advantages from completing a virtual kind of online form that digs into the medical history, because the doctor will get an actual report that's systematic, meaning it goes through the organ systems: heart, lungs, kidneys, immunizations, etc., and provides that information in a very organized way, so that the doctor is not having to look at a checkoff form, a PDF kind of form. They're actually getting a report as if it had come from the physician. And
So,
if I may add one
yep,
other thing,
yep, sure.
it will also e-patient um, will look for discrepancies between medications a patient takes and
Wow,
and the health
excellent.
history, and if there are discrepancies, it'll bring that to your attention. So these are the kinds of things that were helpful to me in my practice treating special needs patients, and then I realized, wow, this would be helpful to anybody, um, and why isn't this available? Let's make it available. So let's spend a few years building this, and that's what we've done. So it's very much is in keeping with the kinds of frustrations that I had when I moved to electronic record. That, why can't I have a good medical history, and then why can't I make a virtual medical history, and then why can't I connect it to a point of care support system that helps me understand patients' medical histories the way that a dentist would want to understand it, providing alerts, et cetera.
So
So
you're
I've
bringing
answered
up
that.
something. Yeah, no, it's great. You're bringing it. You're maybe talking about two different areas because it was my second part of the question. You said that patients are concerned or maybe concerned that 6 people are looking at my forms. I have the opposite feeling, and I think a lot of consumers do when I fill out a patient information health history. Nobody's looking at it. Why am I even filling this out when
Mhm,
nobody's going to take the time? Because
mhm,
I know if I check the box that have I been pregnant or become plan to become pregnant, I guarantee you no one will ask me any questions about it. So
yeah, yeah,
I think
yeah,
they aren't looking at it, but you're
mhm,
telling me that it is, and the reason I think no one's looking at my paper form is because you can't understand it and it looks like it just goes into a file somewhere.
mhm,
So you're
mhm.
telling me that the benefit to a practice in having a digital form is, just let me know that again.
Absolutely. Yes. I imagine looking at an artwork piece of art and you like it, it looks pretty good. But if you don't know anything, any background about the artist, the time period, symbolism, use of colors, use of light, it doesn't have quite the impact. Well, if you're looking at a PDF form that has a bunch of check marks on there, what kind of impact is that going to have? Well, only as much as a clinician is willing to give that. And clinicians and doctors, they know what I'm talking about. And
Mm.
throughout a long day, you're seeing 20 people and you're looking at these pieces of paper. You don't always get answered the questions that you need to have answered in order to operate on that patient. And those answers are really pretty clear. The things like you want to know, is the patient have any hemostatic incompetence that they might bleed? You need to know about that. Do they have susceptibility to infection, either short-term or long-term? Do they have stable or unstable disease? That's what we're looking for. We want to know, can I come in and give anesthetic and do my work? What are my concerns?
Mm.
Well, Dental Symphony's e-patient that you guys make available to your customers, look for alerts in those areas: hemostasis, infection, the things that would tell me that I need to modify my care, either prescribing antibiotics or being aware of bleeding issues, as I say, unstable disease. And I can look at those alerts in that report and go right to work. That's why we say you can see patients in 5 minutes and actually start working even the most complex medical histories, if they are analyzed and organized in a way that lets you look at those issues. It has real meaning. It has real meaning to a clinician, and the thought that when you compare that output and the usefulness of that with a piece of paper, that bunch of check marks, there's no comparison. So as you're looking at that piece of artwork, if you know the background of it, and it really impact you because of that, it matters. So people the doctors that use this understand the importance because it speaks their language.
So here's my third problem. I go to the dentist twice a year, but once a year I have to fill out that stupid form again. What's your
I
name?
know, really.
What's your address? They asked me the same questions that they did last year. Is there anything that an online forum like ePatient can do for that?
Yes, of course. As patients update their medical history by request, this reminds me, I want to mention a practice can use Dental Symphony and look at their upcoming appointments. It'll read the appointment book of the practice management system, and they can choose, I want to have everyone that's coming in the next 2 weeks who has not updated their medical history in the last 11 months, 18 months, 6 months, whatever. I want them to get a link to their medical history so that they can update that. So it's talk about really organizing the intake and assessment of patients. Really good at that. But to answer your question, when the patient gets to their form to fill out, they see the same form, so they don't have to go back through. I mean, they see it and they may not make any changes at all, or they may add a medication or take off a medication or add a recent surgery or whatever, but it's a whole lot less work. And that's the kind of thing that modern forms like ours ought to have. Those kinds of things that are really helpful. For instance, and adding family members, so that rather than have to put
Oh,
in the address and phone number and everything again, all that's transferred forward, and you just add that. If you have a signature pad, so that the patient can sign everything ahead of time, a progress bar that shows them how far along they are in the forms. Those are really helpful things, and those are kind of modern features that an online form system ought to have. Patients like it, staff like it, saves time, saves money, and it helps with safe care, and everybody just feels better about it.
great. We only have time for one more question. And you mentioned it even at the top, and you've been more passionate about this over the past few months in terms of the medical analytics that you
Yeah,
can see
yeah.
across patients. Give me,
Hmm.
like something that you're really excited about that, even at what you would use in your practice.
Yeah, thank you for asking that, Keith. That's an important feature. It's a new feature, and it's a unique feature, very helpful to practices. Let's say average general practice has 3,000 patients. Wouldn't it be nice to know, and you can do this using ePatient, wouldn't it be nice to know what are the most common medications that patients take within that practice? What are the top 5? What are the top 20, what percent, and be able, so you can you look at the analytics of your registration system and determine what those are, and not only what they are, but you can click on that feature and get the drug description, and then also click on another list that will show you your list of patients that are taking those medications. These are the kinds of things that in staff meetings with your staff, you can point this out and say, look together at what the top medications are. And if 20% of your patients are taking hypertension kinds of drugs, then you need to know that, 20% of the people that are coming in this week are probably taking this medication. Let's know what they are. Let's talk about it. How do they interact, and what does that mean to us as providers? So, information like that's mined from your own patient base is really helpful. And then, of course, the partner to that is, what are the most common conditions? And so that's one of the things that ePatient will do, is provide the analytics for a practice of the most common conditions that people report when as they come into your practice. And you, in the same way you do with the drugs, you get ready for you learn your practice, you teach your staff your practice, and that is that the top 5 conditions are in the practice are hypertension, diabetes, thyroid disease, whatever. It's going to be different places and according to the age range, but you can click then through that feature and not only know what the percent of patients suffer certain conditions, but you can click and go to a point of care support center that will answer the kinds of questions that dentists have about those conditions and how do I manage them. What a great thing for your staff to study those and review those together. And so that's one of the great things. We have more analytics in the drawing board that we're building, and we'll be releasing that are for the kinds of things that go back to the very first, my reason for building Dental Symphony, and that is, how do we help the clinician at the chair with the things that they really do? We try to take care of people and we try to get them well. What can help with that? So that's one of the things that we're very proud of, the analytics that are associated with the input of reception of patients into your practice. Great virtual forms, digging deep in the medical history, drug descriptions, analytics, custom forms, as many as you want. I'm proud that we are partnered with ProSites, and that they make those available. I think dentists ought to continue to look into those, and the ProSites does it. And thank you, Keith, for your outstanding staff doing a great job getting customers set up and training support. It's just so wonderful features. And it's
Well,
forgive me
thank you,
for all
Tom.
that, but
Yeah,
we
sure.
were really proud of it.
No, no, no. I really appreciate that. And thank you, Tom. And I'll just give me 1 second. I just want to let everyone know that if you're interested, I appreciate you saying this, Tom. Even before COVID, especially now since the COVID-19 pandemic, ProSites is really focused on partnering with dentists to help you acquire,
Mm,
engage, and retain your
mhm,
patients in the most efficient way. And our online form solution is presented by Dr. Tom through an e-patient. If you're interested in it, give us a call. You should see that number on the screen at some point. But just give us a call and we can have a discussion about how we can help you with that and other solutions, including reminder solutions. And you can
mhm,
integrate your e-patient online forms right onto your website so that you can start to get your patients to complete their intake process before they come into the office. Just think about that extra 10 minutes that you can have times 20 patients a day in not having to wait for them to fill
mhm,
out a form in
mhm,
the office. And you actually don't even want them in the office at ahead of time. Dr.
mhm.
Tom, I really appreciate it. It's always good to see you. I
It
hope to
is.
get to come
Thank
out to
you.
Fort Worth soon, and probably not until it cools down because I'm assuming it's getting ready to get really hot out there. But
Absolutely.
so looking forward to seeing you and the team as soon as possible. Thank you so
Yes.
much for taking the time today.
Well, Keith, you're very welcome. It's good to talk to you. I look forward
All
to
right.
seeing you soon.
All right. Thank you. Have a great day.
You're welcome. You too.